And now breast cancer and mammograms. A Senate subcommittee reviews recommendations following a National Institutes of Health conference. The head of the National Cancer Institute and the Deputy Assistant Secretary of Health and Human Services joined members of cancer prevention groups in offering their views. Pennsylvania Senator Arlen Specter chairs this 3-hour hearing.
Hearing of the Appropriations Subcommittee on Labor, Health, Human Services, and Education will now proceed. Our hearing today involves the issue of mammograms, and on January 23rd, a report was issued by the National Institute of Health Consensus Development Conference concerning breast cancer screening for women between the ages of 40 and 49, with the essential conclusion being that there was insufficient evidence to warrant mammograms for women between 40 and 49. That report was greeted by considerable controversy, to put it mildly. Dr. Daniel P. Kopens of the Harvard Medical School said that the committee's report was fraudulent. Dr. Bernadine Healy, former head of the National Institute of Health, said that she was very disturbed, or at least quoted as saying that she was very disturbed that a group of so-called experts challenged the notion of early detection, saying, quote, "What are they saying is that ignorance is bliss." And Dr. Richard D. Klausner, director of the National Cancer Institute, characterized his response as being shocked at the finding. It was greeted with some substantial concern in many quarters, including the United States Senate, which heard a resolution yesterday introduced by Senator Snowe, and many of us spoke on the floor, including my distinguished colleague from Texas, Senator Kay Bailey Hutchison. And the resolution passed by a vote of 98 to nothing, expressing concern about those findings. When I took a look at the conclusions as they were reported, that there was not enough evidence to conclude that women in their 40s would not benefit from mammograms as a part of routine health screening, the converse question occurred to me, and that is, was there sufficient evidence to conclude that women in their 40s would not benefit from mammograms as a part of their routine health screening? If you put the burden of proof in saying that the medical evidence has to establish a benefit, as opposed to the evidence being inconclusive or in equipoise with a very substantial body of evidence saying that the mammograms are very important, then it seems to me we're allowing the burden of proof issue to dominate. With so much evidence, although perhaps inconclusive or perhaps even in equipoise as to whether it is a matter of benefit. Ordinarily, we have these hearings to find the facts and decide what to do. I would say at the outset of this hearing that I have a fixed opinion on this subject, that women in their 40s ought to be tested with mammograms. And for just a personal aside, I had a situation where the doctors concluded that I ought not to have an MRI, and I insisted on an MRI and finally got one and found a life-threatening situation with meningioma, and have yet to understand why, in a context where there's a non-invasive proceeding which can be accomplished, that the medical experts are reluctant to undertake that test. And I think that there is over-concern about the cost-effectiveness ratio. The real issue in our health system is whether we have enough MRIs and mammogram machines and experts to administer them to handle the people who could reasonably benefit from them. And I'm convinced that we do. You might have to give an MRI in the middle of the night for $100 or $75 instead of 3 o'clock in the afternoon when it's convenient for the patient at $800 or whatever the cost may be. But with that own experience that I've had, I'm convinced that we ought to err on the side of safety. There's a real problem on the consequences, it seems to me, of this study having been released, discouraging many women from having mammograms. People don't like to go get tests because they're afraid of what the tests may show. And with this tremendous splurge of publicity that women can't benefit from mammograms or don't need mammograms in the 40 to 50 age category, I think that it's going to discourage a lot of women from going to get the mammograms. Just a word or two about the doctor-patient relationship is about as fundamental a relationship as we have in our society, and I think sometimes we don't really focus, or the doctors don't, and lawyers are equally bad, and judges are even worse, about the impact of the statements on the people. When I had my test and somebody told me I had a few weeks to live, pretty important impact. You say women don't need mammograms, pretty hard to get them back on the mammogram trail. I talked yesterday to Secretary of Health and Human Services, Donna Shalala. I had hoped she would be at this hearing today. She just returned from overseas and she has other commitments, and it may be preferable, as she said to me last night, to hear from the scientists before hearing from the policy experts. And it is my recommendation, thought, and hope that Medicare and Medicaid will cover mammograms for women in their 40s. And if that is done, that will be the strongest national signal about the conclusion of the public policy in the United States on this subject. And we all know that if this test comes out and is accepted as not being indicated for women in their 40s, that the insurance companies won't pay for it and managed care won't pay for it, and then people won't have them available. So I think this is an error which needs to be corrected. Let me welcome my distinguished colleague, Senator Kay Bailey Hutchinson. While not a member of this subcommittee, is always welcome. Senator Hutchinson, do you care to make an opening statement?
Thank you, and I want to thank you, Senator Specter, for having this hearing, because when I saw what the advisory committee for the National Cancer Institute and other organizations did a couple of weeks ago, I was appalled, and I think every woman member of the Senate, I know every woman member of the Senate is equally appalled. And I guess 3 years ago, when we had testimony before a hearing called by Senator Mikulski, we registered that we were absolutely sick about the health care plan that was before us not requiring mammograms and having mammograms covered before the age of 50. And so this is like a festering sore, frankly. And I think it is time that we speak frankly. I hope we can speak with one voice with the facts. I think that to just recapture a little of the history, up until 1993, the National Cancer Institute did recommend mammograms for women before 50, ages 40 to 49, every 2 years, and then after 50 every year. And then a study came out in Canada that said, I think it wasn't shown to be effective, and they then rescinded the guidelines. Since then, I think other studies have come forward. In 1995, investigators found a 24% lower death rate among women who received mammograms in their 40s. In 1996, Swedish researchers in 2 studies found a 44% and a 36% lower death rate among women who received mammograms in their 40s. Right now, we have a mixed message. Breast cancer is the leading killer of women in our country. Of the 43,900 women estimated to die from breast cancer this year, 10,000 will have breast cancer between the ages of 40 and 49. 10,000 women in this country. Now, I hope that whatever you do, you will help us send a clear, crystal message